Good morning, everybody. We're just going to take a wee minute to let everybody join and then we'll get started. Looks like there's still a few people joining. Just give that another few seconds. Okay, I think we'll just get started. Good morning, everybody. Welcome to the Chest, Heart and Stroke Scotland No Life Half Lived webinar. It's really great to see so many of you here today, and thank you from all of us for taking time. We know you've all got really busy schedules, so we really appreciate you coming along to hear from us today. My name is Amanda Johnson, and I am the Chest, Heart and Stroke Scotland National Thrombectomy Educator, and I am going to be your host for today's webinar. Today in the session, we're going to hear from our CEO, Jane Claire Judson, about our No Life Half Lived 2023 to 2028 strategy. We're going to hear from someone who's accessed our services. We're going to hear from our services team about our community healthcare model of support. And throughout today, we're going to hear from a couple of our partners who are going to share about their experience in working with Chest, Heart and Stroke Scotland. Before we get started, just some housekeeping rules. You'll notice that you are automatically being put on mute, and that's just where we do we let the speakers do their bit. And then we'll have a couple of question and answer sessions throughout today where you'll be unmuted. If you want to ask a question, you can use the raised hand function. Or if you want to put a couple of questions to us for the Q&A session, then we do have the chat function as well, and we've got the Q&A function as well if you want to put some questions into there. Okay, so we are going to start off today with a short anonymous 4-question quiz, just to see what you know about our conditions. The questions are all from our Chest, Heart and Stroke Scotland No Life Half Lived 2023 to 2028 strategy, and from our Chest, Heart and Stroke Scotland 2023 1 in 5 research report. So we should be able to put up question 1 for you, and you should be able to select what you think is the answer. Any problems with seeing this, if you go up to the 3 dots at the top, and then you should be able to find the quiz in there, and you should be able to access the questions from there. Okay, so question 1. How many people in Scotland are living with chest, heart, stroke or long COVID conditions? So you should be able to select your answer and then press submit. And we can start to see the answers come up, and I'll give you a few seconds just to select your answer. Okay, so the answer is 1 in 5 and over 50%. So 50 odd % of you got that right. So well done. Okay, on to question 2. And again, hopefully this should pop up in front of you. And again, any problems with that, go into the 3 wee dots at the top and into the quiz. Okay, so second question. What percentage of people with a chest, heart and stroke condition say that they have accessed formal rehabilitation? So is it 90%, 70% or 45%? And again, select your answer and press submit. And I'll give you again a couple of seconds just to do that. I think we've got most responses in. 80% of you this time said 45%, and yes, absolutely, the answer is 45%. So well done to the majority of you for getting that right. Okay, so on to question 3. And this time it is, how many people in Scotland are living with long COVID. So do you think it's 180,000, 103,000 or 56,000? And again, select your answer and press submit. Give you a couple of seconds again to do that. Oh, this one's a wee bit closer. So the majority of you at the moment are thinking it's 103,000 and actually it's 180,000. So that's the right answer. Quite surprisingly, 180,000 people living with long COVID in Scotland at the moment. Great. And then on to our fourth and final question. That should be popping up in front of you now. Okay, so how many people with a chest, heart, stroke condition say it impacts on their mental well-being? Is it 4 in 5, 3 in 5, or 2 in 5? Again, select your answer, press submit, and hopefully you can see the results coming up as well. We can see how important people think mental well-being is when people have one of our conditions. So the majority of people are thinking 4 in 5, 69%. The response is actually the correct answer is 2 in 5. Still huge though, still huge numbers, 2 in 5 people. So thank you very much, everybody, for doing that quiz. That is really great to be able to see where we all are. And what we're going to do is we're going to do another short quiz at the end of today, just to make sure you're all paying attention and taking in the information that we're going to be talking about today. So thank you very much, everybody, for taking part in that. So what we're going to do now is I am going to play a short video for you, and this is so that you can hear from a couple of our partners who have been working with us. So thank you very much to Gurab and Heather there for the really fantastic feedback about working with Chest, Heart and Stroke Scotland. Okay, so now I would like to introduce you to our CEO, Jane Claire Judson, and she is going to talk to us about the No Life Half Lived 2023 to 2028 strategy. Thanks, Jane Claire.
Thanks, Amanda. And just as Amanda said at the start, thank you so much to everyone who's given up time this morning to spend this time with us. We're very aware of the pressures in the NHS at the moment and just how much that you will all have on. So thank you so much for finding the space in your diary today to come along and find out a bit more about our strategy. The truth is that we can't do what we do without you. And so working together in partnership is a key part of our new strategy. And so it's brilliant that so many of you found the time to join us this morning. But if I can take you back 5 years ago when we started out on the No Life Half Lived journey, there's a couple of things that we did as an organisation I thought it was important to update you on and show you the results of what it was that we set out to do 5 years ago. I think it's important to be accountable as a charity partner and explain what we've done and how we've gone about it. So in the health service, many people will be very aware of targets and quite often a controversial subject. But we did set ourselves some targets 5 years ago as an organisation to reach. And on the face of it, they're very simple. Double the number of people that we reach with our conditions, double the number of volunteers, because it's through volunteers that we mainly deliver most of our support. And then in order to support all of that, double our income as an organisation. So 3 very straightforward targets, but as you can imagine, not always quite so easy to achieve. And certainly in terms of the delivery over the past 5 years with a global pandemic in our way to be able to do that. I just want to touch on doubling our reach. It's extremely important to us that we keep our focus as an organisation on the 1 in 5 people living with our conditions. The number of volunteers and the amount of income we raise is only important in so much as can that deliver more reach, more support to help and help to people in our communities when they need it. And in doubling that reach, we can manage to increase that capacity for ourselves, but also for yourselves to refer into to support people with our conditions. What's absolutely fantastic, and you can see here, you might think, well, your circles here are full of that lovely magenta pink. Where's the actual result? Well, that is the result. We did manage 100% against our doubling reach, which is fantastic, even against the barriers that we faced. And we more than doubled the number of volunteers that we work with in order to deliver that. We didn't quite double our income. It's quite challenging to do that in the current economic climate and the issues that we've all faced over the past 5 years. The pandemic certainly saw that as a major challenge for us. But what we have done as an organisation is to make sure that every penny that we do raise does go as much as it can do to direct frontline services. And I will touch on that in a second. So just to give you some of those impact numbers, in terms of who we've reached over the past 5 years, we've reached over 600,000 people through our services across Scotland. I'm extremely proud of the work that the staff and the volunteers and the charity have done to achieve that. I want to touch on that 88% figure there. While the money is the thing that helps us do what we want to do, it is important to us that every pound that comes into the charity is used wisely. And it's also to give you assurance as partners that what we do is extremely cost effective and we look after those pounds. Now, most organisations will aim for a sort of 70% of that pound, 70% pence in the pound going towards services frontline. But as an organisation, we've worked incredibly hard to make sure that money is funneled directly to frontline services. And we've now managed to bust our 80% KPI and to take that to 88%, so 88 pence in the pound going directly to our services. And I think that's really important, but also demonstrates to yourselves that we are a well-run organisation that can deliver on our objectives and to make sure that we use any money invested in our services very wisely. Just having a look at the numbers, many of you will be really familiar with these numbers, but I think it's really important to just touch back around how many people in Scotland are affected by the conditions that we support. So 1 in 5 people in Scotland have our conditions. And that means that each of us, we might not have the conditions ourselves, but we will know someone who's got at least one of our conditions, if not people who've got multiple conditions across the 4 that we support. So in terms of chest, heart, stroke and long COVID, if you look at those numbers, they are significant. These are some of the biggest conditions facing Scotland with the biggest challenges in terms of making sure that people can achieve no life half lived, but also that we can support the NHS to release pressure and make sure that people are supported in community and at home. What is quite often striking is the number of people who don't know that they have a condition or they've got an undiagnosed condition. And we talk here about the 55,000 people who are living with undiagnosed atrial fibrillation. So it's people walking around with something they're not even aware of. They don't have the right information to manage that risk factor, and they might not know where to go to when they start to feel those signs and symptoms. And so it's really important that we tackle those issues as well as people who have their diagnosis. What's really important to us as an organisation is listening to people with our conditions and what they tell us about their lived experience. Both of that sort of blue light moment, perhaps, that ambulance at the point of having a stroke, or perhaps it's the diagnosis that you get as you go through a longer journey. But it's really important to us to understand how that feels for them and then what happens afterwards when you're back at home, back in your community and trying to get your life back. And here's some quotes from a survey that we did of around 1,800 people in Scotland, the largest survey of its kind for people with our conditions, to ask them what it's like for you, what matters to you, and what is it that you would like us to focus on and deliver for you as your health charity. And I think there's a couple of things here I'd just like to pick up on. One, here's the quote around no ongoing support available, only able to access rehab support when health declines. And I guess that's one of the key things that we work on, is trying to support people to stay out with the NHS so that when they do access the NHS, it's for something that enables you to support them. You're working at the top of your licence as healthcare professionals, but also taking that pressure off of the NHS. And where we can support people with rehab and community to do that in partnership, that's what we aim to do through our strategy. This quote around not being able to breathe is scary and it makes you anxious, and that makes breathing worse. So we know that if people don't have the right support at the right time, it can exacerbate their conditions. And then, of course, that creates more pressure within the NHS as people come back in, but quite often for things that if they spoke to us and had that support at home and in community through our services, they might not need to do that, and to help people to live well with their condition on a day-to-day basis. So here's some more stats that have come out of that survey, people telling us about their experience of living with our conditions. And I guess one of the things that really shocked me, and I'll be really upfront, I was a bit naive about this stat, and it took us a while as an organisation to get our heads around it. We started to look at the data that tells us how many people are getting formal rehabilitation through health services. And how much of that is actually recorded. And the data is inconsistent across Scotland. We have to kind of be upfront about that. There are places where it's collected very well, but other places where it's not so well. And I think we know all of the issues that there are around data collection within the NHS. But where we got to is understanding that around half of people are referred to some kind of formal rehabilitation. And of course, across the country, that rehabilitation in and of itself can be inconsistent and patchy. We work with some amazing partners doing fantastic work, but a hand on heart, I don't think any of us can say that it's 100% consistent across Scotland for our 4 conditions. And then what really struck us is what that means for people receiving supported self-management and community recovery once they leave those formal rehabilitation services. And the truth is that isn't counted at all. There is no data on that. And at first I doubted that. I kind of pushed back and said, that can't possibly be true. Somebody must be counting it somewhere. But it turns out we're not. So we have our data as a charity that we can look at, but there is no central or national approach to looking at that supported self-management in community and finding out who's receiving that. But by putting those data sets together, and of course the lack of data set together, we can come to a conclusion, which is that more than half of people in Scotland aren't getting that supported self-management, and many aren't receiving the formal rehabilitation that we might expect from our National Health Service as well. And we do understand the challenges around that, but I think it's important that we're upfront and transparent about the big challenge that we're all facing. Now, you might think, well, if that's you coming up with that figure, Jane Claire, how can we trust that? Is that something that we can rely on? We ran our strategy past the Scottish Government. We made sure that the ministers and the civil servants were aware of this, and they can't come back with any better figure or any better position on this. So while I wouldn't say they're comfortable with it because they see the challenge in it, they are happy with the fact that this is the situation as it is at the moment. So one of the key things we want to do with our strategy is to dig into that and really try to find out what that means for people, but also how to get a better sense of the rollout across Scotland of these sorts of services. One of the key things that came out of this, though, and this is really important to us as a charity, because we need to know that what we're doing works and is important to people, but also to yourselves as partners, because you need to trust that what we do has an impact, is that when we asked people, when you receive a Chest, Heart and Stroke Scotland service, what happened to you? What happened to your health and well-being? And what do people who didn't receive that service think? We know that people supported by us rated their health and well-being greater than those who didn't get any Chest, Heart and Stroke Scotland support. So we know that from the survey that is the result of the work that we do. If people don't receive our services, their health and well-being is affected. And if you do receive our services, it will improve and increase for you. And I think that's a brilliant message for us as an organisation, for our volunteers and our service users, but also a really strong message to yourselves this morning around the fact that if you partner with us and work with us, you will see an impact for your patients and the people that you care about. But it's really important, like I say, to listen to people with our conditions. So we've got Alison here, and I just wanted to pick out something here around the start of her journey, that she thought that she wouldn't be able to walk on her own again. And you can imagine just, overnight that happening to you and suddenly that ability being taken away and trying to face your life with a completely new reality. And what's really important here is that the support that we were able to give her as a charity meant that she managed to start to get that back. She started to get her independence back. She felt more confident. And that's a really amazing thing that we can deliver for people after that formal rehabilitation has taken place, is to take that journey onwards and to make sure that people can make the most to get that no life half lived for themselves after they've developed one of our conditions. Here's some of the information that we got back from our survey, and that we also did some deep diving with our stakeholders. We surveyed stakeholders, but we also did one-to-one interviews and collated that information to get that feedback. It's really important for us to understand what our stakeholders think. And it was absolutely brilliant to see people see us as a genuine partner that can deliver impact. But one of my favourite quotes is the one in the bottom corner here. I just think they've always been a really good ally. And that to me is at the heart of what it is that we're trying to do. It's possible that at times we might criticise things in the media, we might campaign for things that we don't think are right. And I think we'll all agree that there's a place for that. But ultimately, if people can see us as an ally, as people that you can work with, can be supportive, and that we can achieve things together, then that's exactly where we want to be as an organisation. But of course, it's not just all good feedback that we get. We do sometimes get constructively critical feedback, and that's just as important. Sometimes it's even more important because it helps you to understand how to be a better organisation and to deliver better for people with our conditions. So we did get feedback about how we could focus better on that supported self-management space, on that community recovery, things around rehabilitation, but also a push around prevention and population health and what it is that we can do around the policy agenda. And I think those were things that we needed to take on board during the review of our strategy that took place last year, and to build into the new strategy. And I hope that when you start to see the new strategy, we take you through the model, I hope you see that we have built that in and that we have listened to that. So that all brings us to the strategy that we launched in October last year. And some of you might need to squint at this depending on the size of your screen, but we're very happy to send it to you, and it's within our strategy document. And this really encapsulates everything that we're going to try to do over the next 5 years to support the 1 in 5 people with our conditions. Now, you've got Chris Doherty here this morning to take you through the detail of the model, and I tend to steal his thunder sometimes in these things and start to talk about it because I get a bit too passionate about it. So I'm going to try to not do that this morning. There's a couple of things I just want to pick up. The first thing is that we've distilled a very complex whole systems approach into one page. So of course, there's more detail sitting behind this, but I think it's a really helpful visual so that we can agree what it is that we want to do together and which parts we want to partner on. If you're looking at your screen directly, then on your left-hand side, we represent our 4 conditions. But what we do pick up in that left-hand side is also that 1 in 3 people will live with more than one of our conditions. And of course, at the centre of all this is people. So we might think about conditions and work on those kind of silos or those specialities, but ultimately we need to think about the person, and they have multiple issues going on for them with their health, but also in their wider life. And we need to be remembering that. And as an organisation, making sure that we put that person at the centre. Down the right-hand side, we talk about the enabling factors for us to deliver our model. So we need that measurement. Can we really understand supported self-management in Scotland? Do we really know who's receiving that and whether the quality is there? We're going to campaign on the right to rehab. We're going to make sure that right to rehab is on the Human Rights Bill. There might be some delays at the moment. There's some stuff going on politically that we need to be mindful of there, but we will still campaign on that extremely important issue to make that a right for people to be able to access that in Scotland. We want to increase our reach, and we want to do that not just through ourselves, but through partnerships. We can't do this alone. We can't reach the number of people we need to alone. So partnering with yourselves to do that is critically important to us. We do need to tailor what it is that we need to do. So a key bit of feedback is that people need to feel as though a service wraps around them. And as a charity, we have the time and the ability to do that. I totally understand the time pressures in the NHS, that in a 10-minute or 15-minute consultation, that just might not be possible. And I'm sure that's extremely frustrating at times for the healthcare professionals who are on the line this morning. But that is something that we can provide for people as that time and space, particularly through our volunteers, for people to talk through what it is that they need from the service and from the rehabilitation. And of course, connecting, and today is part of connecting. How do we connect people across Scotland? How do we connect individuals with our conditions, but also at a national level to make sure that all of this can be achieved? Down the middle, we've got our model in 4 parts. Prehab and prevention, the acute event bit, the diagnosis piece, which you guys do brilliantly and give people that first start along their journey around their diagnosis and what's happening to them with their health. At home in your community is the bit that we major on. That's the bit that we really do offer to you today to say we can deliver this for you in partnership to make sure that ongoing journey in community is there for people, that safety net, that challenge to the isolation and loneliness that people feel with their conditions is there for them. And of course, growing the chain of support. And again, along with connection, that's part of today. We need to grow that chain across Scotland so that people do feel held. There's a network, and that through our connections, we actually create more impact than if we're working alone. I'm going to mention prehab and prevention very quickly, mainly because we've been doing some work this week with one of our partners, Walking Football Scotland. And I've talked a lot about partnership already this morning. And I was at the Tartan Teapot Trophy presentation on Monday, our tournament that we had on Monday with Walking Football teams. It was an absolute joy to be there. And Gillian Mackay, MSP, was actually on the Chest Heart Stroke Scotland team, which is a win for us. It was absolutely brilliant to see her there supporting us. And in Parliament yesterday, she spoke during the health and social care debate. And she talked about the 90 walking football teams that are going to be at the tournament in June, the Scottish Cup tournament on the 22nd of June. And walking football kind of embodies, for me, the prehab and prevention element of what we do. But it runs through every single part of our model because walking football can help people, that physical activity, that engagement, that connection that people can have through an activity together helps us through each of those 4 steps in the model. But the quote that she gave yesterday in Parliament was, "The reach of many of these organisations that are involved is far beyond anything that we could design here in Parliament." But that's also true in terms of we can't design it ourselves from Chest, Heart and Stroke Scotland, and the NHS can't design that prehab and prevention and intervention on its own either. And it's through those sorts of activities that we can able to get that impact. 90 teams coming together of people who are absolutely audience for the 1 in 5 and our risk factors. And that's how we reach people, is doing something they find fun and that they want to connect with and enjoy, and then to get our messaging across. The impact we want to see, we want to fully understand that rehab and supported self-management picture and landscape and understand that evidence gap. We want to get that right to rehab into the Human Rights Bill to make sure everybody can leverage that, both the individual, but also our public bodies can actually use that as a way to direct services. We want to narrow that gap between those who have access and those who do not have access. And we understand that even if somebody has a service on their doorstep, it might not be that easy for them to actually get to. It might be hard in terms of time, or they need a carer, or they need transport, and that whole systems approach comes into that there. And then, of course, we want to deliver our community healthcare support service model, which Chris will talk about later. It's the heart of what we're going to do, is to make sure that's available across Scotland. And our targets here, because I do love a target, is that we will deliver that directly to 50,000 people a year by 2028, 100,000 through self-directed management, and that's really important that sometimes people want to take that self-directed approach, and 25,000 people through partnerships and collaborations. And that will force us and make sure that we remember that partnerships are really at the heart of what we do, and to make sure that we work with all of you who are here today to make that happen. So finally, it's really just that message about wanting to work with you to provide better care. And there's no better way to kind of explain that than through 2 of the healthcare professionals that we have worked with. Amy Small, I think, is actually on the line this morning with us, which is fantastic. Amy is a GP that we work with, who's also one of our clinical advisors. And I think, the quote from David Anderson here is that we are managing to help him deliver quality wraparound care for patients is exactly the offer that we're making this morning. And that if you want to pick that offer up, we'd be really willing to work with you and to take those contacts forward to see what it is that we can do together. So thank you very much. I'm just really conscious that there's so much information to try to give you in a short space of time. But anything that you've heard from me this morning, we can pick it up in the Q&A, or indeed after this webinar, to make sure that we can connect with you and support you in what it is that you're trying to achieve. So thank you all.
Thank you very much, Jane Claire, for the insight into our strategy. That's really helpful. Thanks very much. Okay, everybody, we are going to move on now. I am absolutely delighted to introduce Margaret Walker, who's here to share her experience with us. And Margaret's supported by Joanne Carey, who's our Chest, Heart and Stroke Scotland Community Support Services Coordinator. So I'll hand over to you now, Margaret.
Good morning, everybody. I had a series of 3 ischemic attacks between September and November 2021. I was just 57 years of age at that time. I also found out that I had at some time 2 lacunar strokes. They were explained as silent strokes. So all in all, I got quite a shock. The symptoms I had during the attacks were dizziness, painful arm and a painful leg. This had gone on for a month. I thought I had been knitting too much, hence the sore arm, and thought the leg pain was connected to other health conditions that I have. So thankfully the NHS were there. They dealt with me very efficiently, got me on the right medication, sent me home. 2 days later I was back in, sent me home again. And then the final one in November, they had to check me out for a 3rd time. So after that, because it was during COVID pandemic, there was no access to a stroke. Here we go, can't get the word, a stroke clinic. So Marion, the stroke nurse, she would phone, I think it was every 3 months in the first year. But when I got home, I just felt totally lost, like I'd fallen off a cliff. There was so much going through my head and that I didn't understand and just didn't know what to do. Because I could walk and was able to look after myself by way of personal care, there was no need for me to have any sort of physiotherapy. So my depression went really quite bad. And then I remembered that Marion had given me some booklets in the hospital on the first visit. So I looked them out and they were all from Chest, Heart, Stroke Scotland. And I took the step to phone up the advice line, and it was the best thing I'd ever done. I phoned and the ladies at the other end of the phone were just wonderful. They took the time to let me talk and say what was worrying me, and then start to point me in the right direction. And the first thing was the self-management, supported self-management course. And again, because it was in pandemic times, it was all done like this, but through Zoom. But it gave me the chance to hear other stroke survivors and what they were going through and experiencing. And then I realised that some of the things that were happening to me were not just my own crabbedness, and it was something that did happen to everybody in that group. So the course really opened my eyes to understand what A, I had gone through, and B, it wasn't the end. It was just the start of a new journey. And I know a lot of people use that terminology, but it really was. The things that really clicked was how to pace yourself, and also if you had a good day and then a bad day, it wasn't a disaster. My husband had been very keen for me to keep doing exercise till he drove me to distraction. But again, the course was able to put his mind at rest and explain to him it's not exercise as in a gym. I've got to keep moving little and often. And it took a huge pressure off me, just that one thing. So after the 6 weeks, I then was able to start doing the Francis's class, the functional strength and balance class. And to give you to understand, as a teenager, I was a competitive figure skater, so I thought the balance would be a real scoosh. And boy, was I wrong. The minute I was told to lift my leg, I near fell in the living room floor. So I realised there was a lot still to be worked on. I couldn't raise my left arm higher than my waist. Now I can put it right up over my head. I still attend that class, and when you're on the class, it's all obviously Zoom, but I knew every week that the other stroke survivors were going to be turning up, so that pushed me to turn up. It was good it was in the house, because I don't think I would have been so committed if I'd had to go to an outside exercise class. And it has just been amazing, and seeing the difference in myself, seeing the difference in other attendees at the class. So I've been doing that since 2022. So I recommend it to everybody, everywhere I go. Also the supported self-management, because as I said, it didn't just help me to understand a lot, it also helped my husband. And I think that's a good thing for friends and family who are supporting people with any of the conditions. So I was doing so well in the functional strength class that Francis suggested I became a volunteer, and that's where I'm at now. Last year, I was back in touch with Joanne here, and I went through all the training, and I'm loving it. I do face-to-face, one-to-one visits with service users, and just recently I've joined the kindness calls, because sometimes you can have more time. How am I trying to explain this? Sometimes you have a person that you're face to face with, and then maybe when that finishes, it'll be a few weeks till there's another match made. So I thought, well, in that time, I could be helping somebody else just by the calls. So I'll always be grateful to Chest Heart Stroke Scotland, because after I came out of the hospital, I thought my life was ended. And every time I was taken back in for the care that I needed, I kept looking around me and thinking, is this it? Is this the life that's ahead of me? Sleeping 23 out of 24 hours a day and not being able to do a thing. And they have turned me around and shown me that there is a life, and I'm glad I found them. So thank you all very much.
Thank you so much. Thanks, Margaret. What a really inspiring story. That was really incredible. It's so great to hear, and I think as well, to our NHS colleagues in Ayrshire and Arran, and our Chest, Heart and Stroke Community Support Service in Francis as well. So that it's so great to hear, and you can see all the love hearts and things that are coming up. So thank you very much, Margaret. That's fantastic. Okay, everybody. Following on from Margaret's story, we're going to hear from one of our partners that we've been working with to support the people who are affected by our conditions. So a very special thanks to Jenny Minto, who's the Minister for Public Health and Women's Health, for our feedback there. That's really fantastic. Thank you. Okay, folks, so we are now going to have the first of our 2 question and answer sessions. Your microphones will be enabled. So if you want to ask a question, then please do so. We've also got the chat function though, and the Q&A function. So if anybody wants to ask something at this point, now is the time. As I say, there will be another question and answer later on. Okay, so Robin, anything in the chat?
Not at the moment. I think we have a hand up just now though from Gillian.
Great. Gillian, do you want to ask your question?
Hi there, I'm one of the speech and language therapists covering Perth and Kinross. We used to have really good links, even prior to me starting, I think a couple of years ago, with sort of one-to-one chest, heart and stroke community support. That was really useful for our patients who we're maybe coming to the end of our therapy with, but you know, it's about building confidence in the community and that kind of thing, that we're not really able to keep going with. But chest, heart and stroke volunteers were there to pick that up. Unfortunately, though, recently it seems to have moved quite a lot online, or walking groups and things that aren't appropriate for many of the people that we are supporting. So it was just to see if there's a plan for that one-to-one support to resume, or you know, even some more group support across the county, because some of our members, like was mentioned, they can't travel as much. So yeah, just really that was my question, if there is plans for more one-to-one support.
Thanks, Gillian. I think Jackie looks like she wants to come in with that. Jackie, do you want to introduce yourself?
Sure, I'm Jackie Slater. I'm the Physio Development Manager at Chest, Heart and Stroke Scotland, and I worked in the Community Support Services team for a while. I think visited one of the services that you're talking about in Perth, Gillian, and really saw the value of that a couple of years ago now. So I think what you're saying is that face-to-face services are really valued in that community and in lots of other places as well. I will pick that up. Do you know Darlene Drummond?
It was another contact we had, and I know there is a recent staffing change. We're just waiting to hear. I don't know if that's Darlene coming in or not.
Darlene is the regional manager for Perth and Kinross, and so I will pick up with Darlene and get you some specifics on that, Gillian. But yeah, there had been changes in staffing. So you know, long-standing staff member who was really quite central, I think, to that Perth face-to-face service has moved on. But I'll get your details, Gillian, pick that up with Darlene and look at that with you, because we do get that feedback. We try to offer a range. You saw with Margaret there, you know, virtual worked for her, but I think with communication difficulties, some people really appreciate that face-to-face. So thank you for that.
Yeah, thanks. That's great.
Gillian, what was your surname there?
It's Dora, D-O-R-A.
Great, thank you.
Thank you very much, Jackie, and thanks, Gillian, for your question. We've got Jackie with her hand up in the audience.
Hi there, I'm Jackie McCullough. I am one of the Tobacco Cessation Prevention Officers with Quit Your Way in Ayrshire and Arran. And it was just a wee question around referrals. So obviously I know that Chest, Heart and Stroke do have their own smoking cessation leaflet, which is it's a really good wee leaflet. We've got a lot of them that we give out. But it was more about the kind of referrals to the service. Now, in Ayrshire particularly, we don't get a lot of direct referrals from yourselves. And I'm wondering if that's maybe because you more signpost rather than refer. But what we are trying to do is, instead of signposting, actually get other agencies to refer to us, because then that gives our advisors a chance to phone the person and actually explain what the service can do for them, because it's a bit scary being told, you know, you have to stop smoking. And I think a lot of people think that the Quit Your Way service will come along and hit them with a big stick and take their cigarettes off them, kind of thing. So we are trying to encourage actual referrals from anyone rather than signposting. So it was just to say that we do a very brief advice session in Ayrshire and Aram, which covers all the ways that you can refer and just gives people a wee bit more information if they're speaking to someone who is a smoker or a vapor and is looking to stop. So just to kind of maybe tie in with somebody that covers Ayrshire and Aram to have a chat with them about that and see how we can help each other.
Thank you very much, Jackie. That sounds like a great opportunity. Jane Claire, do you want to come in on that?
Yeah, just to say, Jackie, absolutely fantastic. And it's that partnership working, I think, that I was talking about earlier. One of the things that we have been doing in Ayrshire and Aran is talking to Lynn McNiven, who's heading up some of the public health work. And that was exactly the topic, was how can we create a referral pathway between the NHS and other types of partners, whether that's actually within the NHS itself, because sometimes that doesn't always work, but also then obviously with health and social care more widely, and then with the third sector. So I can pick that up. I'm not sure if Claire Bennett is on today because she's also been involved in that work. But we can certainly pick that up for you, Jackie, because we ask people to refer to us, but equally so we can refer back out. And I would agree with you, signposting only takes you so far. And quite often what you need is somebody to pick up the phone to you and say, you'll know that you've been referred, and we can start to do that support with you. Sometimes that's much easier than asking the individual to take that action when quite often they've got quite a few things going on for them.
Yeah.
So we're really happy to pick that up and take that forward.
Yeah, and we always find as soon as you give them our number, in some people's heads that they've done their bit, they've got the number. Yeah. And that's kind of all they have to do. But obviously Lynn McNiven, we're based in public health, so Lynn McNiven's our director. So I would imagine she would come to us with that. But as I say, we do a very brief advice session, which is really good, and it's just to give kind of local information. So if any of your local staff want to come on that, then I can leave my email address in the chat and people can just contact me if that's okay.
Lovely, thank you very much, Jackie. That's brilliant. I just want to go to a couple of that have popped up. I know there's a couple with their hands up, but there's a couple have came into the chat. Giesmick and Grampian has said, how often does the supported self-management course run and how do people register online? So who wants to take that one on?
I think Chris is going to cover that in his presentation. I'm wondering whether that's the best.
Yes,
before
probably
I take even more of his material.
Yes, exactly. So if that's not answered, then we'll come back to that in the next Q&A. But hopefully it should be. And then I just wanted to pick up on something that Peter's put in the chat. And Peter said, as a stroke survivor, why is there such a variable between health boards and then within these such a varying level of service? I live in the rural Highlands and was very surprised by the complete lack of support. I have a young family and feel totally let down despite knowing how important rehab was in the early stages, having worked with stroke survivors in the past. Jane Claire, do you want to come in on this again?
I mean, first of all, Peter, I just completely agree with you, and I feel that sense of frustration myself, and I know that both the teams at Chest, Heart and Stroke, but also teams within the NHS feel that frustration. I imagine it must be really difficult if you're a stroke specialist in one area and you look across the wall and you think, oh, how come they're getting to do that and we're not? I think there's a couple of issues there. I think, first of all, we need to keep really focused on the stroke improvement plan. And we do know that from the stroke care audit that the consistency isn't always there with reaching those guidelines and those standard levels. And there needs to be a level of kind of honest discussion about why that might be in certain areas. Some people will talk about things like, in Highland, or maybe that's like a rural and remote issue. And on the one hand, that will be a factor, but I equally think that those things can be dealt with. I don't think that means that it's a reason to not deliver the services that we've all agreed nationally should be delivered in a particular area. So I think there are some real concerns. Scotland is a relatively small country population-wise, but obviously geographically is large. But I think we can get everybody in a room to talk about those things and to figure out how do we sort of push through those barriers. I think certainly as well, the work that we can do is sometimes to create some capacity in areas where they are struggling. So if there's things that we can do that support along the way as a service is developing or is trying out something new or is trying to improve their service, then we're really up for supporting that and making sure that that happens. But I absolutely feel your frustration with that.
Thanks very much, Jane Claire. And then we'll go to Roisin.
Yeah, it's not so much as a question really, but just to flag, I guess, the role of community link workers and how they can support this work because they've got the time that the GPs don't to spend with someone and actually kind of explore what support they need. So I run the Scottish Community Link Worker Network, and we've already got really good relationships with Chest, Heart and Stroke Scotland, particularly through Chris. But just to flag that I've got details of community link workers from across Scotland. So if there's anything we can do to support making those connections and helping Chest, Heart and Stroke Scotland sort of reach people that, you know, they might be struggling to reach, then do let us know. I'm more than happy to help with that. Great, Roisin, thank you very much. We probably do have time for just one more. So Angelina, did you have your hand up?
I did indeed. Thanks. Morning, everybody. Angelina Foster, Public Health Scotland. Firstly, great seminar, really enjoying it, and I'm learning lots. So fab. Thank you all. My question relates to the fact that so many of these conditions are preventable. And although, as everyone has said, you know, the work that's done with people who have these conditions, you know, valuable beyond measure. But my question, I think, is around the balance of your activities between prevention work and that support for those with any of these conditions. And I suppose it's, do you think there's scope to do more in the prevention area, not, to be clear, at the expense of the support work, but rather, you know, with more capacity from wherever? So I'm just keen to tease out, yeah, prevention and your thoughts around that, and whether Public Health Scotland can help there.
Thank you very much, Angelina. Jane Claire?
So thank you. And it's a subject that does occupy our minds a lot, because we want to see a reduction. Rather than us trying to reach more and more and more people, we would much rather sort of focus on a much smaller group where we can really put those resources in, because as you say, Angelina, a lot of these conditions are preventable, or at least can be delayed until a later stage in life, so people get more quality of life for a longer amount of time. I'll not pretend that we have, you know, huge amounts of resource to put into it, and my team would be very advising about, you know, it's an elephant that we can't eat ourselves, you know, that has to be done in partnership, and that's absolutely right. I think there's a couple of things though that we've been doing recently that help us a little bit in that prevention space. I think the first is beefing up the policy and campaigns aspect of that. So I think there's things that we can do there as an organisation that does deliver services. So we see on the ground the impact of people who have our conditions where it wasn't prevented, and then what happens when they find out it could have been prevented. And, you know, for people to come to terms with that, I think, is a real struggle. So working in that policy and campaign space for us, you know, we submitted to the sugar, salt and fats consultation and put in a very strong response to that. I would also say that in terms of some of the activity that we do, in my head, it's that horrible phrase, bang for your buck. So the work that we do with Walking Football Scotland, that we do with Paths for All, that we're doing with the SFA, what we're doing there is making sure that we can do prevention work, but also work that can carry over each step of our strategy. So it means that for us, that's a much easier place to be. I think what's really helpful for us is the partnership work that we can do with other organisations like Public Health Scotland. So we can't collect data in the way that Public Health Scotland does. We can't have that national approach in that way, and that huge amount of sort of focus on it. But what we can do is we can draw on that, but then we can also pilot and test with communities. Even when I think about Grow Chapel, our community garden, the sorts of things that we do that won't be done through the NHS, you know, they just won't be. So we can sort of do that and pilot that and test that. I would also mention the other flip side of that, which is around the risk factors. So we've got Rona Martin, I think, with us this morning, who has the Queen's Nursing Award. And as part of her project, she's been looking at the community identification of atrial fibrillation. So I was talking about, you know, there's so many people are walking around with a risk factor and don't know it. And there's a space in prevention, I think, for us to do blood pressure checks, AF checks, to be taking people through their risk factors and taking them on that journey. And I think the way that we do it is about going to people in their communities. So going into Maryhill, going into Drumchapel and hitting those communities and saying, how can we help you best? And that's where things like the walking groups come out, because that's what people want to do. And that's when they start talking about their health. They don't really want to go to a health check, but they will come to a community event and then allow us to create that trust and that confidence with them. You know, it's a thread running throughout our strategy that anything that we do, we want to find a partner to help us to do it. And that can be in terms of on the ground delivery, but it can also be in terms of the development of that data and that evidence as to what works, and then to roll it out. I often talk about as being a national charity with local impact. That the only reason we have the national bit is to reach people on the ground, and that connection sometimes it could be really valuable to other partners. So we would offer that back to Public Health Scotland in terms of saying that's something that we can provide, but it must be challenging as a national body to sometimes get that on the ground sort of experience and insight. But yeah, I mean, every charity says that they want to kind of go out of business because they'd rather the issues weren't there. People will always have strokes, people will always have heart conditions, and people will develop respiratory conditions. But if we could prevent the preventable ones, then we have more resource to support people where that's not so possible. And that would be a real aim, I think, for Scotland over the next 10 to 15 years, is to get to that place.
Great. Thank you very much, Jane Claire. That's fantastic. We're going to have to move on, I'm afraid. I just wanted to quickly say, though, thanks to everybody for your lovely comments in the chat about Margaret sharing her experience with us. Thank you very much, everybody, for doing that. That's really nice, and we'll pass those back to Margaret. So we're going to take a quick 5-minute break. If you could come back just after past, give yourself a bit of time to go and grab a quick cup of tea, have a quick stretch of your legs, and we'll come back in 5 minutes. So just after past, folks. Thanks very much. See you soon. Welcome back, everybody. Thank you very much all for nipping away and getting a quick cup of tea. Hope you've all had a good couple of minutes. I'm conscious of time, so I think we'll just move straight on. We are going to hear now from Chris Docherty, who is our Community Engagement Coordinator, and Chris is going to share to us a bit about the community healthcare model of support. Over to you, Chris.
Thanks, Amanda. I appreciate that. Hi, everybody. I'm Chris Docherty, Community Engagement Coordinator for Chest, Heart and Stroke, obviously. Thank you again for all your time today. Really, really appreciate it. And also the conversations that we're having there. It's really, really nice to hear everything coming in and to hear that everybody's on the same page with some great contributions so far. So thank you so much for that. I suppose the big question for us is why do we need our range of services? As we alluded to earlier on, it's if you ask a room full of people if anyone has our conditions or their friends or their family have one of our conditions, then unfortunately hands go up. We all know that to be the case. Off the back of our survey in 2023, we established that 1 in 5 of people in Scotland have one or more of our conditions. I won't read out the figures because you're all very aware of them, and we'll be sharing the slide afterwards. But there's a few big hitters in there that kind of took me not by surprise, but kind of hit me hard. There's almost 500,000 people living with COPD or asthma, 300,000 people with coronary heart disease, 136,000 people living with the impact of stroke. And that big number that we probably didn't expect a few years ago, but 180,000 people living with long COVID. That's a new one to all of us. We also know through our research that almost 1 in 3 people have hypertension, which, as we know, can greatly increase the risk of heart attack, stroke, and heart failure. And it's again great to hear about some of the research and some of the activity that we'll be involved with that across the country. So it's great to see that we are kind of leading forward on that one. The need, well, I suppose we know the need because the people with our conditions have told us. Over 500,000 people are just not getting the right support and not accessing that first step into supported self-management. The charity, we strongly believe that everyone with our conditions should have access to quality self-supported self-management and community recovery service, which is critical really to living well with our conditions. I suppose the headline is people supported by us rate their health and well-being greater than those who didn't get our support. And I suppose the question is, why wouldn't we act to make sure that that number increases across the country? So, as Jane Claire alluded to, that with the new strategy comes a redesigned service delivery model, our Community Healthcare Support Service, which has a handy acronym of CHSS. So it's really, really difficult for me to forget. It's a model of delivery encompassing the entire journey of those who need our services within the community, including 4 strands of delivery. So that reads top to bottom, our prehab and prevention, our acute event and diagnosis, our at home and in your community, and finally that piece about growing the chain of support. Now, I'll just take you briefly through these. Again, we're trying to cover everything in 4 or 5 minutes, but please reach out to have a conversation if you want to learn more. So I'll start off at our prehab and prevention, which was interesting. We were having a conversation about that just before the break. It's made up of our health defence and health information team. In a nutshell, the aim is to get in front of our conditions, to work in the community with strong partnerships to deliver health screening, education and support on the ground level. It is it's really to improve the knowledge of risk factors, identify early signs and symptoms, tackle health inequalities, and to help both individuals and communities across Scotland to live healthier lives. In Glasgow, our health defence team has been performing health screening in both Maryhill and Drumchapel, and working with third sector partners to deliver a wide range or to a wide range of demographics with some great results. We've worked with some fantastic partners across this 2-3 years. Underneath sits This sits our acute event and diagnosis. So this is our advice line, our health information, our education and e-learning teams. For many, our acute event diagnosis team is the first step in accessing our services for both individuals and organisations. The knowledge across this team on our conditions and the barriers and problems that people who have our conditions face is roundly praised by a lot of the partners that we have. And has had life-changing impacts. You've heard from Margaret earlier on about her access to the advice line. In my day-to-day role, I always advice line is at the tip of my tongue. It's always the first thing that I mentioned. It's the gateway into all of our services, and that first point of contact for individuals or organisations who support them. Under the strand, we also have our resources hub, which I think somebody spoke earlier on about our smoking cessation health booklets. So these are free health booklets that can be ordered by anyone in Scotland, including information which covers all of our conditions. Available in multiple languages such as Urdu and Punjabi and Polish, which we did a bit of outreach to organisations in Maryhill around. The information is also available to access online, so it's just fantastic for anybody that wants to access it via whatever medium they wish. As well as these, we have our education e-learning courses. These are designed for professionals, and with some great feedback from people who have accessed these services in the past, which has been fantastic. Moving on to our at home and in your community. So underneath this sits our clinical community support, physical activity and walking teams. These are vital in delivering tailored and personalised approach to support recovery at home and in the community. The ethos and the strapline of what matters to you being entirely integral to everything that they do. The teams here work directly with service users, offering tailored and personalised approach to recovery on their own journey. And really, we heard it earlier on, it can be truly heartwarming to hear the case studies of people supported by these teams. And spoiler alert, you'll hear some of these very soon as well. We also have this is a coming soon. So to the question earlier on, please get in touch and I'll provide some more information on this. This is based on the Stanford model, which is evidence-based. It's a 6-week supported self-management course, and this is including modules on managing your condition with optional activities dependent on the person that's accessing it. From studies, it's been shown that this approach can benefit in results such as decreased pain and health distress, increased energy and less fatigue, increased physical activity, decreased depression, better communication with physicians, decreased social role limitations, and increased confidence in managing chronic disease. Like I said, there will be more information on this coming, and please be in touch if you would like to learn more about what this course offers as it comes. And finally, moving on to that growing the chain of support, it's last but by no means least. We all know that the lived experience and the benefits of the sense of community and shared experience is core to growing the chain of support. A large part of this chain are our peer groups across the country who are essential to that continued support in the community. These groups can be the absolute best showcase of the spirit of no life half lived. But we don't want to end that participation there. Everyone who uses our services is an ambassador for the charity, for the services and for the ethos of No Life Half Lived. Who best to shout with us outside Parliament or to zip line across the Clyde, not me, to raise money or to tell their stories and experiences of living with one of our conditions and how CHSS has helped them in their journey. And that very quickly is our new service delivery model. It's a model that delivers at all stages of an individual's journey. Again, emphasising that individual with our conditions. It's part of a Scotland-wide community of colleagues, volunteers, partners, professionals, and service users. It's from left to right. It's prehab and prevention. It's acute diagnosis. It's at home and in your community, and it's growing that chain of support. So we have a quote here that summarises why we created this model and what it's hoping to achieve. I'm going to summarise the summary even further. So in short, it's helping people to look after themselves with support from their communities to live the best life they can, where they are at the centre of centre designing and deciding the healthcare they would like to receive. And finally, of course, partnerships. We've been mentioning it from the very start of this presentation now, and it's my favourite word in the world, that and opportunities. It's why we're here today, and it's why we want to engage with everyone on this call. With strong and transparent and active partnerships, we can collaborate, we can build, we can deliver across all the conditions that we support. And we do this, and hopefully we'll do it with yourselves, through direct service delivery, through trusted and quality signposting, through creating strong local, national service delivery, participation, support, and conversation. We do this already through partnerships, but standing still is moving backwards. So we must push on. We must form new relationships. And I personally would welcome any of you to get in touch to find out how we can work together, or how we can evolve any existing partnerships to a new level, to help us make sure that going forward, no life is half-lived. And I'll leave you there, and hopefully I'll share this with you as well with our advice line. As I said earlier, it really is the gateway to all of our services. I'd welcome any individuals or organisations or people representing anyone to call up this number, get in touch, and find out how we can help people who we support. Okay, thanks very much.
Thank you very much, Chris. We're just going to move on to a video now on more of our partnership working. Great, thank you very much to Charlie and Anne-Marie for the partnership working initially and for their feedback as well. Thanks very much. Okay, folks, we're going to move on to a very quick quiz again. If you want to pop up question 1, Ian, we're going to go back and see what you've learned from today's session. Okay, so question 1. What percentage of people in Scotland are living with a chest, heart, stroke or long COVID condition? 50%, 35% or 20%? To pop that in. Great, so yes, absolutely, most of you are right, 60%, and it is 20% is the answer. So thank you very much. Question 2. Hopefully an easy one for you to answer here. Who rates their wellbeing higher? People who have used Chest, Heart and Stroke Scotland services or those who haven't? So these are your 2 options. And if you want to pop in your answer, press submit. Fingers crossed, yes, 100% of people have said that yes, people that have used our Chest, Heart and Stroke services as part of our 1 in 5 report did report that their wellbeing was higher after using Chest, Heart and Stroke Scotland services. And question 3. What services are Chest, Heart and Stroke Scotland delivering in Scotland? Healthcare support and advice for people with chest, heart and stroke and long COVID conditions. Self-management, supported self-management services, or community healthcare support services, or D, all of the above. Pop your answer in, press submit. Well done. 100% of you said D, all of the above. Yes, absolutely. We do provide all these services in Scotland. So thank you very much, everybody, again for doing that. You've obviously been paying attention, so thank you very much. Okay, and we're just going to take a couple of minutes now to do another quick question and answer part. So if anybody's got any questions, again, if you could pop your hand up, or if you want to pop something in the chat, your microphone should be unmuted now. Roisin.
Oh, it's just a question for Chris, just in terms of the Health Defence Project, and just if you could tell us about any plans to expand that to other parts of Scotland.
Yes, certainly, Roisin. Thanks for that. Yeah, we are just about to launch in Tayside. And we'll have that service available in the Douglas area in Tayside. So we are just kind of dotting the I's and crossing the T's on that one. So as soon as it is up and running, I'm very aware that I'm keen to involve a lot of the community links workers in that area. And make sure that we're getting them up to speed on what the service is. Again, that service, just to reiterate to people, the Health Defence project or the Health Defence service is probably easiest to split it down into 3 things. It's screening, it's education, and it's support. It's checking blood pressure and cholesterol. It is educating people as to what that is and how we can begin to think about that. And then it's supporting them to be able to kind of manage their health conditions on their own. It's about spending time with people as well and giving them that space to have the conversations about their health and having these conversations about how they can make changes into their life. So, yes, Tayside very soon. And yeah, anything else that about it, we'll let you know as soon as possible.
Thanks very much, Chris. Thanks, Roisin, for your question. And Abigail's put in the chat as well, Chris. Working in Dundee, I'd be interested to find out more about this service as well. So that's great. Thank you very much, Abigail. Anybody else got any questions? Probably take one more if anybody's got anything. And Fiona as well is putting in the chat as well that she also agrees she'd be interested to find out more. And we'll pop up in Chris's information in a minute. Just for you all to be able to get in touch to find out how we can work together. Okay, well, thank you very much, everybody. If there's no more questions, we're just going to move on. And we're going to now play our No Life Half Lived film. And this really just explains why we are needed and highlights the support that we bring to people living with our conditions. Such a powerful video. Every time I see it, such a powerful video. So thank you to everybody that contributed to that video. Okay, so if you've got any questions after today, please reach out to us. I know there's been a lot of discussion in the chat today and a lot of back and forward about putting you in touch with the right people, but please do get in touch. We would really encourage you. You can do that through Chris, who presented today, our Community Engagement Coordinator. If you want to email Chris, and Chris will either get back to you or pass your details on to the appropriate person. You'll also receive an email after today's session that shares with you the resources from today as well, so you'll get that information too. So thank you very much for joining us, and I just want to pass over to Jane Clare for closing remarks. Thanks, Jane Clare.
Thanks, Amanda, and thanks everyone for this morning. I know it's a huge chunk out of your diary. I always think that the number of people come back after the break is a good sign that you all return to spend a wee bit more time with us. I just wanted to touch on, really guess what the crux of this morning's been about. The three people that we've seen on the video and Margaret herself, I think really encapsulate that the support that they got is a joy for us to deliver. It's absolutely why we get out of our bed in the morning, but we know that 500,000 people don't get it. And they could do. And the people on this call this morning, you will know many of those people, we'll know many of those people, but joining those services up, getting those referral pathways in place and creating those partnerships is how we'll really be able to close that gap. And so working together, if there's anything that you've seen today that you think, yes, that sounds like something we could work on together, and please do get in touch with the contact details that we've shared. I just also want to say it was brilliant to have the offer from Public Health Scotland, and I can confirm that we'll take that up with you, Angelina, to try to take that forward. We can't really deal with the prevention issue as a single organisation, but there's no organisation in Scotland that can do that. And I think, Chris talking about health defence and the work that we do there, there's definitely something that we can do there that means that we can hit the prevention piece, but also make sure that people find us if they've already got one of our conditions. I think there's some real strength in there. And I've just really loved all the chat. I don't know if you've been able to see all the chat coming down the side, just people engaging. That just always brings a smile to my face, is seeing people make those connections and picking up the things that we can do together. So thank you so much for being such a brilliant sort of group of people engaging with us as an organisation, and the door is always open. So it's not an end at the point at which we sign off today. You've got those contact details, whether it's today, tomorrow, or even a couple of weeks' time. Please do get in touch with us so we can see that we can do for the 1 in 5 in Scotland. So thank you very much for this morning.
Thank you, everyone. Have a great day. Bye.